Malats, who is also a member of the World Campus. She is a scholar activist. She is the director of the National Cancer Research Institute of Madrid. And please tell a little bit more about yourself, Núria. I know she is one of the people who is very cutting edge regarding prevention of pancreatic cancer, and I gladly give you the floor. Núria.
Thank you, Jan. Thank you also to Gergana for giving me the opportunity to increase the awareness of pancreatic cancer, that I think it's very much needed. I have, so let me share. Can you see the slides?
Perfectly.
Okay,
great.
Excellent. So let me first introducing me. I'm MD, I'm epidemiologist. I'm leading a group on epidemiology, on genetic and molecular epidemiology, that we integrate several layers of information. But most importantly, I'm a board member of Pancreatic Cancer Europe, that is an organization that pretends to increase awareness on pancreatic cancer and has a very strong agenda in this regard. Also, I'm member of Inspire to Live that very much supports this PCE agenda in pancreatic cancer, increasing awareness. So this is the topic of today. And let me start commenting that actually pancreatic cancer, although it's not a very frequent cancer, as you can see in this graph, is the only cancer that both incidence and mortality rates parallels. In the other ones, incidence, it's much larger, much higher than mortality. But in pancreatic cancer, due to the very small survival and low survival and high aggressivity, both rates parallels. What is worrisome is that actually the frequency of pancreatic cancer has increased in the last decades, and it is predicted that it will become in the second position in the mortality cancer ranking after lung cancer in the next years, actually in less than 10 years. And the difference, you should keep in mind that pancreatic cancer is much less frequent than lung cancer. So this is quite an important prediction, and we should take them very seriously into account. So it's not only in the States, that is the previous figure that I showed you. It's also in Europe that pancreatic cancer, we have we observe the same patterns of increasing mortality and actually incidence of pancreatic cancer, both in men and women. And what we observed also in Europe is that in 2017, we had more deaths of pancreatic cancer than of breast cancer in our continent. So, and this is the final slide that I showed you regarding the panorama of the dismal panorama of pancreatic cancer, and this regard on how 5-year survival has increased in the last periods, comparing the 1970, 1977 to 2007 and 2013. And what you can see here is that the pancreas is the last in the ranking, meaning that it's the one that increased the less the survival during these 2 periods. So how to control pancreatic cancer is out of control. It's increasing and we cannot control it from any of the tools that we have. So we have to think and brainstorming a little bit how to control pancreatic cancer. And in this regard, I reviewed the 3 levels of prevention that from a public health standpoint, we always handle it. So primary prevention, that actually impacts very much on incidence and mortality in regards to avoiding risk factors or increasing preventive measures. Secondary prevention impacts only on mortality and in regards to screening when the disease is still asymptomatic. So to do this, we need to define high-risk population and to have very good early detection biomarkers or imaging tests. And tertiary prevention only impacts on mortality and regards to treatment to prevent tumor progression. So in pancreatic cancer, there's the largest investment have been done in tertiary prevention. And nowadays there's much better resections, surgical resections, that is the primary treatment option for pancreatic cancer, and also better personalized chemotherapy. The problem is that only 20% of the patients, when they are diagnosed with pancreatic cancer, can be offered with these novel treatment or therapeutic strategies, because 80%, most of them, have the disease already disseminated, metastatic. So the aim here, the aim is to go beyond, to reach the population when the disease is still treatable. So in the screen, and we have to conduct screening programs in this regard. So we need to increase here, the importance here is to increase the awareness of pancreatic cancer at several levels and with many, many actors, many players in this regard. So I have listed the levels and the players here, and there's many that I think we should consider increasing the awareness of pancreatic cancer. And let me start with the potential patient. So meaning that this is a healthy individual, but with a high risk of developing pancreatic cancer. What happens with this population? So we have estimated that actually 64% of the Europeans, they do not know about pancreatic cancer. They do not know where pancreas is located, and they do not know the risk factors associated with this disease, meaning that they cannot avoid the incidence and the development of pancreatic cancer. This is a slide that I usually present in my presentations, scientific presentations, and it shows you the etiological scenario of pancreatic cancer. And what you can see here is that actually there's many risk factors. Those in the inner layer, they are the best established, but there are others that are being studied, still studied. We have contributed a lot in defining and characterizing them, but none of them plays a very large role. For example, tobacco in lung cancer, that we can use to identify the high-risk population. So we have to use all of them together, because in addition, they are highly correlated and they interact over the time. So we have to use AI, artificial intelligence, algorithms to have all of them, or to integrate all of them in high-risk population definition through AI. So this is still under research. So although we can say, please do not smoke, or please control your obesity or your diabetes mellitus, still this is an ongoing field. What about patients, relatives, and primary care physicians? So what happens here is that pancreatic cancer symptoms are very unspecific, very difficult to identify. Abdominal pain, back pain, diarrhea, or changes in the abdominal. Here I have placed this leaflet to let you see. So there's all of them, no depression, thrombosis, but they are unspecific. So if there's not jaundice, actually, what happens is that the patients do not identify these earlier symptoms, relatives the same, and even primary care physicians, they do not identify the early symptoms, even signs, and they cannot apply biomarkers or clinical images to identify the problem, the pancreatic cancer there. So in this regard, through the PC, Pancreatic Cancer Europe, we have developed this material to let the population and let the physicians know about what are the 10 warning signs of pancreatic cancer, and also this kind of material, even this type not of documents, so that we ask the primary care physicians to direct the patient to the GI specialist very rapid, so that the pancreatic cancer can be diagnosed when it should be treatable. The other level of awareness regard to medical oncologists and surgeons. So, and this regard to novel treatments. Actually, this is not, nowadays, I think it's not a big issue or a level that we should invest a lot, because physicians, medical specialists, they are more aware about the importance of pancreatic cancer, and their attitude towards the disease has changed. Just 20 years ago, or even less, 15 years ago, their attitude were quite nihilist. They usually, when a patient was diagnosed with pancreatic cancer, they said, well, there's not efficient treatment, so we can do nothing. Let's just be very not active, not proactive in treating these patients. I think that now this has changed thanks to the awareness, the scientific and medical advances in this regard. So let's now jump to the policymakers regarding both services and research. Regarding services, that's clear that, and it has been proved in the Netherlands, the first country, but also in others, that the survival of pancreatic cancer patients increases when their management are centralized in highly referral centers, in very specialized referral centers with specialized teams of health workers, not only physicians, not only medical oncologists and surgeons, nurses, and other kind of health personnel. And however, this is not implemented. It's amazing. It has been proved, but it's not implemented in the other countries, not only in Europe, but in other countries. So why not? This regards actually to a police-based willingness, a health police willingness. So I think that we should lobby in this regard, so that patients with this disease can survive and can benefit of all the advances. Regarding research, it's also we have also seen that a very small budget of cancer research have been allocated to the research to the projects on pancreatic cancer. It's less than 2%. Most of the budget on cancer research is allocated to the big cancers, the most frequent cancers, meaning breast, colorectal, prostate, and lung cancer. And large advances have been done in these cancers, and large increases in survival and in prevention have been done because of this amount of research. So pancreatic cancer should actually be placed on the table, and to have also enough funding for research, because it is increasing and it's becoming an important public health problem. In this regard, Pancreatic Cancer Europe has performed and has conducted several activities to put pancreatic cancer on the table at the health policy level, doing this declaration with many members of the European Parliament supporting this. The manifesto also declaring what are the targets for the next years. Here we said 2020, although the pandemics impaired a little bit these objectives. We have also conducted and reported about inequalities in Europe on pancreatic cancer management and incidence management and survival. And this is also to put pancreatic cancer on European and national agendas. This is also supported by several European members of the European Parliament, we have conducted events at the European Parliament to support all of this. We have we have these quarterly newsletters to keep all the members of the Pancreatic Cancer Europe organization informed about this, and also documents to show how to implement advocacy strategy at the national level. And finally, for researchers, okay, there's a lot of difficulties in conducting studies on pancreatic cancer. And this is because patients are very sick. It's very difficult to get information from patients. It's difficult to get samples from the pancreas tumors, because of pancreas, it's very back in our retroperitoneum. And the mass is surrounded by a big dysplastic inflammation and reaction. So all of this makes to do the research on pancreatic cancer very difficult. So from Pancreatic Cancer Europe, what we have done is to implement a registry in Europe on pancreatic cancer. This is called Pancreas, to show the inequalities in diagnosis, treatment, and also survival, and to identify the gaps in medical research. We have performed brainstorming meetings to identify the needs of research on pancreatic cancer. We show and provide standardized research tools for pancreatic cancer research, and etc. No? And also we have a map that we are building a map to identify the groups that are conducting research in Europe, and also to support young researchers, early career researchers in being trained on pancreatic cancer research. We also participate in reports. This is a very recent report identifying the challenges and needs to joint actions for pancreatic cancer research. This has been published in the UEG journal, and we have contributed to this also. So just to finalize, I hope that I convince you that it's important to join efforts on pancreatic cancer awareness at several levels, and I count of you all to do this. This is a map, heat map, that it's online in the PC website, and we ask you to contribute with what you know on pancreatic cancer in your own countries. We have we have information of several countries, but we still need to complete this map. And to do this, you have to contact our secretariat. Here you have the email. And if you want, well, I hence you to go and visit this website on Pancreatic Cancer Europe. Thank you very much.
Thank you so much, Núria. Well, I should also give the possibility to ask questions. Is there anyone who wants to ask questions or give comments to Núria's presentation? Nobody? Okay. Well, let me. Will not ask you a question, Núria, but I do want to make a remark to which you may respond, because you are one of our members of the World Campus. You are one of our scholar activists, and it is so beautiful to see that we have a lot of patient, ex-patients, family members of patients, friends, and these scholar activists, and you activating as interacting as peers. Can you just tell me in a few minutes how you experience that, this close interaction with patients who you're with as peers?
Yeah, sure. Well, I think this is an amazing source of networking, of teaching, of learning about everybody experience. and to identify the needs to go ahead in from my side, to preventing cancer, not only pancreatic cancer, that is my major interest, but any cancers. Salome, she commented about cervical cancer, and this is a very much need in Africa. And to learn about this, to learn from Salome, to learn from you, it's amazing. So I think that actually we complement our views, and and the World Campus is a unique actually setting where this is done in a very proactive way.
Okay. Yeah. Okay. Thank you so much. Yes, you have been, I'm double tasking now. I'm not very good at that. Checking whether the next presentation is, and the slides are already there. But I
think I have a question, Jan.
Yeah. Please go ahead.
Yes, I have a question. Núria, of course, we're very proud to hear that in the Netherlands we make progress because of concentrating in a few specialized hospitals, and it's probably the Amsterdam and Rotterdam Medical Center. Is that only because we concentrate patients and have better opportunities for doing research, or are there other reasons why it is improving as well?
I think that it's not only improving research. I think what it's improving is the patient management and the speed the patients are treated, are diagnosed, are treated correctly, and with the most novel therapeutical strategies. And it's not only treatment, but it's also the global care of the patient. And this is super important. It's not only the cancer or the pancreas itself, but it's the whole, not the global, the holistic way that these centers are actually doing the health care of these patients. So it's amazing. And nowadays, the way this has been discussed, for example, in the joint action IPAC that has been presented also today in the meeting. And however, I think that there's one deficiency in the definition of these referral centers for pancreatic cancer. That is, it has only been based upon the number of surgical procedures, whipples or total pancreatectomies that these centers do at a yearly basis. And this is not the only criteria, okay? There's many other players and actors that should be, that are important in this endeavor, and there's other criteria that should be commented. But this is a policy-based willingness. I don't know what will or whatever. Okay, if the government or the health policies they do not will to do this, there's many interest behind that impairs to implement these strategies.
Does that answer your question, Peter?
Yes.
Okay. So I propose that we move on.